Strengthening your heart, safe and effective ways to improve heart health. The human heart is an extraordinary, tirelessly pumping organ, essential for circulating blood and sustaining life. While it's widely believed that exercise strengthens the heart, the reality is more complex, especially when hidden heart conditions are involved. For most people, regular physical activity offers tremendous cardiovascular benefits. However, in individuals with undiagnosed coronary artery disease, CAD, where narrowed arteries can silently limit blood flow to the heart, intense or unmonitored exercise can sometimes trigger serious complications, including dangerous arrhythmias or, in rare cases, sudden cardiac arrest. This article explores what your heart muscle is, what weakens it, and how the right kind of exercise, when done safely and strategically, can strengthen your heart without causing harm. The heart, a unique and specialized muscle. Your heart's walls are primarily composed of cardiac muscle, or the myocardium, a unique tissue distinct from the skeletal muscles we voluntarily control, like biceps, or the smooth muscles found in organs like the intestines. Cardiac muscle operates involuntarily, contracting rhythmically and continuously without conscious thought. Its cells are branched and intricately interconnected by specialized structures called intercalated discs, ensuring synchronized, efficient contractions. Packed with abundant mitochondria, the cell's powerhouses, cardiac muscle is built for immense and sustained energy demands. Crucially, the heart's pumping chambers are composed almost exclusively of this specialized cardiac muscle, perfectly adapted for its rapid, powerful, and continuous pumping action. What weakens the heart muscle? When heart muscle is described as damaged or weakened, it usually involves two primary processes: the loss of functional heart muscle cells and their replacement by non-contractile scar tissue, fibrosis. Loss of functional cells, conditions like a heart attack, where blood flow is blocked, lead to the death of heart muscle cells, cardiomyocytes. Chronic stress from uncontrolled high blood pressure, certain infections, e.g., myocarditis, diabetes, heart valve diseases, persistent arrhythmias, obesity, chronic alcohol misuse, recreational drug use, and even some cancer treatments can also cause these vital cells to become dysfunctional or die. Scar tissue formation. Unlike some other tissues in your body, the adult human heart has very limited capacity to regenerate new muscle cells. When cardiomyocytes die, they are replaced by fibrous connective tissue, essentially scar tissue. This scar tissue provides structural integrity but crucially cannot contract. Consequently, a heart with significant scarring will have reduced pumping efficiency, as a portion of its vital muscle mass no longer contributes to the pump. This scarring can also make the heart stiffer and interfere with its electrical signals. Can a weakened heart muscle recover? This is a nuanced question. While scar tissue itself is generally permanent and cannot be fully replaced by new, functional muscle in humans with current medical capabilities, the overall function of a damaged or weakened heart can often be significantly improved. Improvement or recovery can occur through recovery of stunned muscle, heart muscle cells that were temporarily deprived of oxygen but not permanently destroyed, a state called stunning or hibernation, can often regain function if blood flow is quickly restored. Compensation by healthy muscle. The remaining healthy parts of your heart can adapt and become more efficient, undergoing a healthy, physiological enlargement to compensate for weakened areas. Reverse remodeling. In some conditions where the heart chambers have enlarged and weakened, aggressive medical therapy can sometimes lead to reverse remodeling, where the heart's shape and pumping function improve, especially if the underlying cause is effectively treated. Medical management. A range of medications, e.g., ACE inhibitors, beta blockers, SGLT2 inhibitors, and devices, such as pacemakers or defibrillators, are crucial for reducing the heart's workload, managing symptoms, and improving overall heart function. Addressing underlying causes, controlling blood pressure, managing diabetes, treating valve disease, and making significant lifestyle changes are vital for preventing further damage and optimizing the function of existing muscle. While direct regeneration of significant heart muscle in humans is still a frontier of research, involving areas like stem cell and gene therapy, current treatments focus on preventing further damage, optimizing the function of the remaining viable muscle, and managing symptoms. Exercise and your heart muscle, the core relationship. The notion that exercise strengthens the heart is widely accepted, but it's important to understand the specific adaptations that occur and the nuances of intensity. How exercise strengthens your heart muscle, healthy adaptation. For most individuals, consistent, appropriate physical activity leads to profound benefits for the heart. This strengthening refers to physiological adaptations that make the heart more efficient and resilient. Increased pumping efficiency, stroke volume. Regular exercise makes the heart muscle stronger, allowing it to pump a greater volume of blood with each beat. This means your heart becomes more efficient, often leading to a lower resting heart rate, RHR, over time. A lower RHR is a strong indicator of cardiovascular fitness and is associated with reduced cardiovascular risk and increased longevity. Healthy muscle growth, physiological hypertrophy. The heart muscle cells can slightly increase in size, and the heart's main pumping chamber, the left ventricle, may moderately enlarge in a balanced, organized way. This athlete's heart is a healthy adaptation that enhances the heart's pumping capacity. Improved blood vessel health. Exercise helps keep arteries flexible and wide, reducing blood pressure and making it easier for your heart to pump blood. It also promotes the growth of new capillaries within the heart muscle itself, ensuring a robust oxygen supply. The nuance, exercise-induced heart rate versus resting heart rate reduction. A common misconception is that exercise reduces heart rate, generally. This is inaccurate. During exercise, heart rate increases. Your heart rate naturally and necessarily increases during exercise to meet the body's higher demand for oxygen and nutrients. Exercise can reduce resting heart rate. The beneficial effect of exercise on heart rate refers to its ability to lower your resting heart rate, RHR, over time. This reduction in RHR means your heart beats fewer times per minute when you're at rest, indicating increased efficiency and reduced chronic workload on the heart. Conditions for RHR reduction. However, this reduction in RHR is not guaranteed by any exercise. It requires consistency, regular, repeated training sessions over weeks to months. Sufficient duration, meeting or exceeding recommended guidelines, e.g., at least 150 minutes of moderate intensity aerobic activity per week. Appropriate intensity, engaging in activities at least at a moderate intensity, where your heart rate is elevated, and you're somewhat breathless but can still talk. More vigorous training often leads to greater RHR reductions. When exercise might burden the heart, potential risks. While regular exercise is overwhelmingly beneficial, there are specific situations where it can pose risks. Undiagnosed or pre-existing heart conditions. For individuals with underlying heart problems, e.g., hypertrophic cardiomyopathy, coronary artery disease, certain arrhythmias, intense exercise can be dangerous, potentially triggering symptoms or even sudden cardiac arrest. Medical evaluation is crucial if you have any concerning symptoms or a family history of heart issues. Extreme, chronic endurance training. For a very small subset of individuals engaging in decades of extremely high volume, high-intensity endurance training, e.g., ultramarathoners, professional cyclists, there's a hypothesis of specific, rare cardiac adaptations. These might include an increased risk of atrial fibrillation, an irregular heart rhythm, or very minor, patchy fibrosis in the heart. However, for most elite athletes, the overall health benefits and increased longevity, often showing a longer lifespan than the general population, still far outweigh these specific, rare risks. The discussion around athletes' longevity is nuanced, acknowledging potential sport-specific risks, like traumatic injuries in contact sports, but generally affirming a survival advantage for most. Overtraining syndrome. This isn't direct heart damage but a state of systemic burnout from excessive training without adequate recovery. It can manifest as a persistently elevated resting heart rate, chronic fatigue, reduced performance, and increased illness. Finding your balance, safe and effective exercise modalities. The goal is to find exercise that offers significant health benefits while minimizing risks, especially those associated with excessive intensity or high impact. General principles for safe exercise. Listen to your body, pay attention to pain, unusual fatigue, dizziness, or chest discomfort. Stop and seek medical advice if these occur. Start low and go slow, gradually increase duration, intensity, or resistance. Don't jump into too much too soon. Consistency over intensity, especially at first. Regular moderate activity is far more beneficial than sporadic, overly intense workouts. Warm up and cool down, prepare your body for activity and help it recover afterwards. Consult a healthcare professional, especially if you have any pre-existing health conditions, a family history of heart disease, or haven't exercised regularly. They can help tailor a safe and effective plan. Key exercise types for heart health. Aerobic exercise, cardio, the cornerstone of heart health. Activities that elevate your heart rate and breathing for a sustained period. Examples: brisk walking, running, swimming, cycling, dancing, hiking, rowing, aerobic classes. Benefits: improves heart efficiency, stroke volume, lowers RHR over time, improves blood vessel health, lowers blood pressure, manages cholesterol and blood sugar. Safety note: while swimming is often considered low impact, it can pose increased cardiac risk due to cold water, breath holding, and the potential for arrhythmias in individuals with underlying heart disease. Medical clearance is advised before beginning or resuming swimming, especially after a cardiac event. Resistance training, strength training crucial for complementary benefits. Working with weights, resistance bands, or your own body weight. Examples: bodyweight exercises, push-ups, squats, lunges, free weights, resistance bands, weight machines. Benefits: builds lean muscle mass, reducing heart's workload, improves blood pressure regulation, aids weight management, enhances glucose control. Safety note: avoid holding your breath during lifts, Valsalva maneuver, and begin with light weights and higher reps to avoid excessive blood pressure spikes. High-intensity interval training, hit short bursts of intense exercise followed by brief periods of rest or lower-intensity activity. Examples: alternating sprinting with walking, fast cycling with slow cycling, intense burpees followed by rest. Benefits: enhances heart efficiency, increases VO2 max, maximal oxygen utilization, and trains both aerobic and anaerobic energy systems. Safety note: HIIT can place significant demand on the heart and is not recommended without medical supervision in individuals with known or suspected heart disease. Always begin with moderate intensity training before considering HIIT. Low impact and holistic approaches, minimizing risk. These modalities offer significant benefits, often with a lower risk profile for joint strain or overexertion. Yoga integrates physical postures, breathing techniques, and meditation. Benefits: improves blood pressure regulation, enhances endothelial function and circulation, reduces stress, a major cardiovascular risk factor, and can lower RHR. Safety note: avoid hot yoga or vigorous power yoga. If you have cardiovascular disease, opt for restorative or gentle yoga styles. Tai Chi, a gentle, mindful meditation in motion, combining slow movements, deep breathing, and meditation. Benefits: significantly improves blood circulation, lowers blood pressure, improves arterial compliance, and is excellent for stress reduction. Extremely low risk of injury or overexertion, making it ideal for diverse populations. Walking, especially brisk, accessible, low impact, and highly effective for cardiovascular fitness. Swimming and water aerobics, excellent full body cardio, low impact due to buoyancy, ideal for joint issues. Safety note: reiterated swimming should be approached with caution for individuals with heart disease. Consult a physician before resuming water-based exercise. Cycling, stationary or outdoor non-weight bearing, gentle on joints, great for endurance. Safety note, stationary cycling is safer for higher risk individuals. Outdoor cycling may involve balance and environmental risks. Elliptical training, low impact, full body workout mimicking running without joint stress. Low impact dancing, fun, engaging way to raise heart rate, improve coordination and mood without high impact. Pilates, focuses on core strength, flexibility, balance, and controlled movement. Improves circulation and reduces stress. Light to moderate strength training, using body weight or light weights to build muscle without excessive strain, contributing to metabolic health and reduced heart workload. Understanding exertion, how hard is your heart working? To exercise safely and effectively, monitoring your intensity is crucial. Exertion refers to your perceived effort during physical activity. You can monitor your exertion using ratings of perceived exertion, RPE, scales, subjective but reliable scales, e.g., Borg scale 6 to 20, or the simplified 0 to 10 scale. Moderate intensity is typically somewhat hard, RPE 13 to 14 or April 5th, 10, while vigorous is hard, RPE 15 to 16 or June 7th, 10. The talk test. Moderate intensity, you can talk comfortably, but you can't sing. Vigorous intensity, you can only speak a few words at a time. Heart rate monitoring, while objective, remember medications can affect heart rate. Moderate intensity targets 50 to 70% of your estimated maximum heart rate, roughly 220 minus your age. Vigorous targets 70 to 85%. Critical warning signs to watch for, seek immediate medical attention if experienced during or after exercise. Chest pain or discomfort, pressure, tightness, squeezing, or pain in the center of your chest, potentially spreading to arms, back, neck, or jaw. Unusual shortness of breath, breathlessness that feels out of proportion to your exertion, or occurs with chest discomfort. Dizziness or lightheadedness, feeling faint, unsteady, or about to pass out. Heart rhythm abnormalities, feeling your heart skipping beats, fluttering, or thumping unusually hard, a heart rate that is unusually fast, slow, or irregular. Nausea, cold sweats, or unexplained overwhelming fatigue, these can accompany other heart-related symptoms. Guidelines for a heart-healthy exercise routine. For most healthy adults, general recommendations include aerobic exercise, at least 150 minutes per week of moderate intensity, e.g., brisk walking, swimming, or 75 minutes per week of vigorous intensity, e.g., running, HIIT, aerobic activity, spread throughout the week. Resistance training, at least 2 days per week of moderate to high intensity muscle strengthening activities, e.g., bodyweight exercises, weights, resistance bands. Conclusion. Your heart muscle is a uniquely adapted organ, designed for a lifetime of relentless work. While it can be damaged by disease and unhealthy lifestyles, its function can often be significantly improved and supported. Exercise, far from wearing out the heart, strengthens it by increasing its efficiency, reducing its resting workload, and mitigating major cardiovascular risk factors. The key lies in understanding the nuances, that consistent, appropriate exercise helps achieve a lower resting heart rate and healthier cardiovascular system, while the risks of burdening the heart are primarily associated with pre-existing, undiagnosed conditions or truly extreme, chronic training. By choosing suitable exercise modalities, monitoring your exertion, and listening to your body, you can strategically train your heart muscle, ensuring it remains strong, efficient, and resilient for years to come.